بسم الله الرحمن الرحيم. أعزائي طلبة المرحلة الأولى كلية الطب جامعة بغداد. This anatomical lecture is called the brachial plexus, in which we are going to define it in addition to knowing and outline the roots, trunks, cords, branches, reviewing the blood supply of the brachial plexus and its relationship with the axillary artery. In any anatomical textbook, if you come to study the brachial plexus, you will find that there is a sentence saying that it is an intercommunication among the ventral rami of C5 to T1. To understand what is the ventral rami, I mentioned before يعني بالمحاضرة السابقة introduction to the nervous system، وراح أعيدها مرة ثانية حتى نكون بالصورة. أول شيء I have in the body ضفائر عصبية. The plexus يعني ضفيرة عصبية. And the brachial plexus هي الضفيرة العصبية اللي تغذي the upper limb. So when I come to the rami, what's the meaning of the rami? If I look at the section of the spinal cord, I will find that there is a ventral root and a dorsal root. The ventral root is always motor, and the dorsal root is always sensory. The ventral root is efferent, يعني نازل, بينما the dorsal root is efferent, يعني صاعد. Both of them will unite to form the spinal nerve. The spinal nerve اللي أنا علمتك إنه it's always mixed. It's always motor and sensory, and I have 31 pair of spinal nerve in our body. These spinal nerves طبعا belongs to the peripheral nervous system. These spinal nerves, when it merges out of the intervertebral foramen, بس يطلع من الفقرات راح ينقسم into posterior rami and anterior rami، أو نسميه dorsal rami and ventral rami. rami يعني branches صارت. The posterior rami يعني معناها اثنيناتهم mixed، هذا mixed وهذا mixed. The posterior rami is always small ويروح للباك يزوده motor and sensory ما عليه يبي. نيجي ال ventral rami which is larger in size, it will run downward meeting its other antemes forming the plexuses. فإذا the ventral rami هو mixed motor and sensory، جزء من السباينال نيرف طالع وراح يتحد مع البقية اللي موجودين nearby in order to form the plexus. فهذا معناه the ventral rami. When I come to the brachial plexus, it is from C5, C6, C7, C8 and T1. يعني هاي اللي قدامنا كلها تعتبر the ventral rami of C5 to T1. I have a condition called prefix brachial plexus. يعني when there is a contribution of C4, but here T1 will be small. And also I have a condition called postfixed brachial plexus, means that there is a ventral rami contribution of T2, but بيجي حالة C5 راح يكون small in size. Prefix and postfix is not abnormal، يعني هي مو حالة بحيث تكون مو طبيعية أو تخليه تظهر أعراض أو أمراض أو مشاكل معينة. It's ضمن النورمال يعتبر، بس نسميه anatomical variations، يعني ضمن ال anatomical variation with certain percentage in some population. The normal is C5 to T1, but there could be an anatomical variation of prefixed or postfixed brachial plexus. The prefixed يصير من C4 contribution بس T1 راح يكون صغير. The postfixed there will be T2 contribution بس بيجي حالة C5 will be small in size. Now the brachial plexus, to know, it supplies all the muscles of the upper limb except one, which is the trapezius. the trapezius, which is considered one of the axial muscles, which connects the upper limb to the axial skeleton. It is supplied by a cranial nerve اللي هو accessory, the 11th cranial nerve. The spinal root of accessory nerve supplies the trapezius muscle. فالبراchial plexus يغذي كل العضلات مال الأطراف العليا ما عدا الtrapezius muscle. When I come to the brachial plexus, I will find that it consists of parts. تتكون من مناطق. The first part is called the roots, then I have the trunks, then I have the divisions, then I have the cords, then I have the branches اللي هي the terminal branches. هذه لازم تحفظ بالسرع. يعني البارتس هي roots, trunks, divisions, cords and branches. وعندي two mnemonics يعني مقولتين نستعملها بالتشريح. واحدة من عدها is read that damn cadaver book. تاخذ أول حرف من كل كلمة راح تمثل لك roots, trunks, divisions, cords and branches. والشائع بكتب التشريح هي Ron Taylor drinks cold beer. احنا نقول برتقال. Ron Taylor drinks cold برتقال. فهذه تمثل ال parts of the brachial plexus. Now, each part is present in a specific part or region on the body. يعني هسه عندي the roots and the trunks, they are present in the neck. الdivisions مثل ما تشوف موجودة below the clavicle. The cords are in the axilla. والbranches are in the arm. إذا أجي to the roots, to be more specific anatomically, I have two muscles present in the neck. ما مطلوب منك تحفظها، بس لازم تعرف إنه أكو عضلتين هي scalenus anterior and scalenus medius muscle. طبعاً بالتشريح مثل ما أكو scalenus anterior يعني أكو scalenus posterior كذلك. بيناتهم أكو scalenus medius muscle. أصلاً scalenus medius تعتبر كأنما فراش تطلع عليها roots of the brachial plexus. فin between scalenus anterior and scalenus medius emerges the roots of the brachial plexus, so we call the region, هاي أريدك تحفظها, the region of the roots in the body is in the interscalene area. Interscalene area in the neck. بين هاي العضلتين scalenus anterior scalenus medius. The trunks are present in the posterior triangle of the neck. الneck يتكون من مثلثات triangles. One of its great triangles is called the posterior triangle. The trunk is present in the posterior triangle of the neck. Then I have the divisions. We will find it below the clavicle. لذلك قلنا the clavicle is very important لأنه below it there is an important neurovascular bundle that will pass beneath it. The cords are present in the axilla, in the axillary region. The branches you will find it in the arm. يعني أنا من أجي إلى الأكزيلا ما ألقي كل البراchial plexus in the axilla. ألقي only the cords are in the axilla. من أجي على terminal branches ما ألقاها بكل هذه regions. Terminal branches are found in the arm وهكذا. each part هو يحفظ البارتس بالتسلسل و each part in which region in the body it is present. Now this diagram is very simple and it's a very important diagram that you should learn how to study the brachial plexus by this way. يعني كلنا بالبداية من قرينا نرسم هذا المخطط اللي يوضح لنا البراchial plexus. تحط الروتس اللي هي C5, C6, C7, C8 and T1. Look at the union of C5 and C6 will form the superior trunk. The continuation of C7 will form the middle trunk. The union of C8 and T1 will form the inferior trunk. طبعاً إذا قريت أكو upper بدال superior و lower بدال inferior also you are right. يعني أكو قسم من كتب التشريح يقول upper, middle and lower trunk. It's the same. نفسها superior, middle and inferior trunk. كيفك يا تسمية? You are right. Now, each trunk will divide into anterior and posterior division. يعني كل trunk راح ينطيني two divisions, anterior and posterior. The posterior of the three trunks, كل posterior ما three trunks will unite together to give me the posterior cord. while the anterior division of the superior and middle will unite to form the lateral cord, and the anterior division of the inferior trunk will give me the medial cord. Lateral, posterior, and medial are named according to its relation to the axillary artery. هنا راح يجيني الأكسيلاري artery يمشي فالrelation of these cords to the axillary artery اتسمت هذه المسميات وراح نوضحها بالسلايد من نحكي على relation with the axillary artery. يعني the lateral cord لأن lateral to the axillary artery تسمى lateral cord، والميديال cord لأن medial to the axillary artery تسمى medial cord، وكذلك الposterior لأن posterior to the axillary artery تسمى posterior cord. Now, from these cords, I have the terminal branches. The lateral cord will give me the musculocutaneous nerve and give me the lateral branch of the median nerve, while the medial cord will give me the medial branch of the median nerve and give me the ulnar nerve. The posterior cord will divide into two terminal branches, the axillary and the radial nerve. This should be memorized. هذا لازم يحفظ على الغيب. هذه السلايدات المتبقية هي شرح لما هسه وضحته على الدايجرام. It's the same. نفس اللي شرحته هسه تلقى موجود بهاي السلايدين. Now, if we want to ask, are the terminal branches the only branches from the brachial plexus? The answer is no. أنا عندي I have other branches emerging from the brachial plexus اللي هي we call it minor branches. عندي branches from the roots, from the trunks, and from the lateral, medial, and posterior cord. إذا تلاحظ بالتable there is no mentioning of divisions. يعني من نرجع على نفس الدايجرام when we look at it, I have branches تطلع من الروت، وعندي branches تطلع من الترانك، وعندي branches تطلع من الكوردز، وهذه هي التيرمينال branches أصلاً. بس I have no branches from the divisions. فأيضاً هاي ممكن we will find it within the MCQs. The part of the brachial plexus that has no branches is the divisions. When we come to the minor branches, also we should know that from the roots I have the dorsal scapular nerve with the long thoracic nerve. الدورزال سكابولار اللي هو راح يروح إلى الديب muscles الموجودة بالسكابولار region, the rhomboids and levator scapula، بينما long thoracic راح يغذي لي serratus anterior. Trunks, from the trunks I will have suprascapular nerve and nerve to subclavius. Suprascapular nerve اللي هو the navy that passed through the suprascapular foramen اللي راح يغذي لي supraspinous and infraspinous muscle. وthis nerve to subclavius اللي راح يروح لها subclavius muscle. The lateral pectoral nerve from the lateral cord and the medial pectoral nerve is from the medial cord. Both of them will supply the pectoralis minor and major muscles, but I want you to know that the lateral pectoral nerve is named because it emerged from the lateral cord. والmedial pectoral nerve تسمى هيجي لأنه طالع من الميديال cord، مو لأنه lateral pectoral is lateral to the medial أو medial pectoral is medial to the lateral. أصلاً بالعكس من ترجع على الأطلس to the origin you will find إنه the medial is lateral to the lateral والlateral is medial to the medial. فإذا هي تسمت هالمسميات according to its origin. هذه نكمل بها المعلومة about the lateral pectoral medial pectoral nerve لأن احنا أخذناها it supplies the pectoral muscles. Now you understand that it is named because it is originated from the lateral and medial respectively. Also, I have them from the medial cord, I have medial cutaneous nerve of the arm and of the forearm اللي هو يعتبر sensory. It will supply the medial aspect of the arm and of the forearm. From the posterior cord, I have the superior subscapular and inferior subscapular. Both of them will supply the subscapularis muscle and the thoracodorsal nerve, which will supply latissimus dorsi. These are the minor branches in addition to the terminal branches of the brachial plexus. Now let's explain each terminal branch by its own. The root value is wanted. لازم مطلوب من عندك تحفظ الروot value مع هاي terminal branches and they supply مثل ما نعرف كل واحد من عندهم هو motor and sensory mixed. فنعرف الموتور إما رايح يغذي عضلة والسنسري يا region on the upper limb. هذه لازم نحفظها بكل نيرف. Musculocutaneous من اسمه it is muscular يعني رايح إلى المصل and ends as a cutaneous sensation to a specific region on the upper limb. Root value is from C5, C6 and C7 and it is one of the branches of the lateral cord. بالنسبة للnerve supply of it سهلت لك إياها تحفظها إنه it supplies BBC, biceps brachialis and coracobrachialis. These are the three muscles present in the anterior flexor compartment of the arm. فالmusculocutaneous supplies BBC and ends يطلع كlateral cutaneous nerve of the forearm. راح يغذي لي هذه المنطقة اللي هي lateral cutaneous nerve of the forearm. حتى تفهم تشريح وتحفظه بطريقة ما تنسي. من قلت هنا lateral cutaneous nerve of the forearm رأسا نقول منو الميديال cutaneous nerve of the forearm؟ هسه قلنا هو direct branch minor branch from the brachial plexus. فصار عندي the lateral is supplied by the musculocutaneous nerve والmedial is a direct branch from the brachial plexus يسموه medial cutaneous nerve of the forearm. Regarding the axillary nerve, the roots is C5 and C6. It is one of the terminal branches of the posterior cord. It innervates, also it is motor and sensory. بالنسبة إلى الموتور, it supplies the deltoid, teres minor, هاي احنا درسناها بالaxillary region, بس هسه نضيف لها long head of triceps brachii. Triceps is ثلاثية الرأس, عضلة موجودة بالextensor compartment of the arm. The whole extensor compartment of the upper limb, حتى هيك نحفظها بشكل كلش سريع ومفهوم. The whole extensor compartment of the upper limb, يعني whether of the arm or of the forearm, is supplied by the radial nerve, ما عدا the long head of triceps. triceps عنده 3 رؤوس, medial, lateral و long. اللونج هو اللي supplied by the axillary nerve. يعني إذا نجي هسه على الصورة, أول شيء the axillary nerve من اسمه راح نلقاه بالأكزيلا, وأني شرحته previous lectures that it passes through the quadrangular space, one of the intermuscular spaces present there. Entim ويا posterior circumflexohumeral artery. You will find it on the surgical neck of the humerus. It will supply the deltoid الموجود و supply teres minor. وهسه راح ينطي branch إذا الترايسبس long head. بينما الترايسبس lateral و medial head وكل البقية extensor compartment is by the radial nerve. Now, how does the axillary nerve end? It will end as a cutaneous branch supplying the upper lateral part of the arm اللي هو يسموه regimental badge, يعني منطقة الباج اللي يحطوه جماعة الكشافة, الشرطة, الجيش. هذا مكان الباج is supplied by the axillary nerve. Upper lateral part of the arm is cutaneously supplied by the axillary nerve. رأسا من قلت upper lateral لعد lower lateral منه from the radial nerve. بما أنه اللاترال عرفنا الأبر by the axillary واللور by the radial, لعد الميديال منه by the medial cutaneous branch of the arm اللي ذكرنا one of the minor branches of the brachial plexus. This is regarding the axillary nerve. بالنسبة إلى الميديان nerve, we will find its root value is C6, C7, C8 and T1, and it is formed by the lateral branch of the lateral cord and the medial branch of the medial cord, forming the median nerve. Also, it is mixed. It has motor and sensory branches. If we look at the motor, معلومة ننطيها إنه the median nerve gives no branches in the arm. Gives no branches in the arm. فأيضا هذه من ضمن الMCQ ممكن يجينا which nerve, which terminal branch that gives of the brachial plexus that gives no branches in the arm. ونعدد terminal branches تختار الميديان nerve. It gives no branches in the arm. But as you see, it gives branches to the flexor compartment of the forearm. هذه العضلات أنت راح تتعرف عليها لما ننطي in the next lectures. راح ننطي منطقة الأرم والكيوبيتال فوسا والفور أرم، راح نتعرف على أسماء هذه العضلات. in this lecture ما يحتاج تحفظ هاي العضلات، راح نجيبها ونتعرف عليها وراح نذكرها بالمستقبل. So I want you to know that the median nerve supplies the flexor anterior compartment of the forearm بهالشكل for the time being. And in addition, it will supply نقول the thinner region of the palm. What is the thinner region of the palm? هذا the palm of the hand. المنطقة اللي هي باتجاه الثumb، هذه المنطقة العضلية بها عضلات متعددة بعدين نتعرف عليها، نسميها the thinner region أو the thinner muscles. بينما of the little finger هذه باتجاه الميديال is called the hypothinner. فالميديان nerve will supply the muscles of the flexor compartment of the forearm أو the anterior compartment of the forearm and the thinner muscles. Okay? فهذا بالنسبة إلى الميديان nerve. بالنسبة للsensory, does it give a cutaneous branch? Yes, it gives cutaneous branches. The cutaneous branch is given to the lateral مثل ما تشوف هذا بالبينك to the lateral 3.5 يعني digits هذه region of the palm and 3.5 digit area بالنسبة إلى البالم. بالنسبة إلى الدورزال aspect of the palm, we will find it supplies the nail beds. هذه nail beds is supplied. لذلك when we will يعني sometimes when we have infections in these regions, it is supplied by the median nerve. The radial nerve, if we ask which branch of the brachial plexus is the largest branch of the brachial plexus, we will find it is the radial nerve. So the radial nerve is the largest branch of the brachial plexus. It is formed by the roots C5, C6, C7, C8, and T1. It is one of the terminal branches of the posterior cord. It supplies the whole extensor compartment of the upper limb, of the arm, and of the forearm, and the tendons of the wrist, and except, as we said, the long head of triceps, which is supplied by the axillary nerve. Does it have a cutaneous branch? Yes. Also, it has cutaneous branch which supplies the lower lateral part of the arm, and also we will find it in the posterior extensor compartment of the arm and forearm. Also, the dorsum of the hand, as we see here, it is supplied by the radial nerve, يعني the lateral aspect of the dorsum, بينما the medial aspect, whether from the palm or the dorsum, is by the ulnar nerve, اللي we will mention it in the next slide. The ulnar nerve, the root value is C8 and T1. It is a branch from the medial cord. This nerve is called the nerve of the hand. يعني من نقول the nerve of the hand هو the ulnar nerve. لأنه as you can see here that أولاً it gives no branches in the arm also مثل الميديان nerve. فصار عندي the median and the ulnar nerve. Gives no branches in the arm. It gives branches to few muscles present in the flexor compartment of the forearm. But in the hand, look, it gives to numerous or to most of the muscles of the hand, of the palm of the hand, which will be mentioned in the lecture of the hand, muscles of the hand. These all of them are supplied by the ulnar nerve. Does it give a cutaneous branch? Yes, and it will supply the anterior and posterior medial aspect, 1.5 digits, and also the palm. وهنا 1.5 digit, and also the dorsum of the hand. That was regarding the ulnar nerve. Now the brachial plexus, according to its importance, مثل ما شفنا وجود الواسع بريجنز متعددة ذكرناها, it should has its blood supply. لازم يكون nourished by blood. To make it easy for you, Any nearby artery is present. If you will mention it, you will be right. يعني منه من الارتريات موجودة بذيك المنطقة. If you say it is supplied from the subclavian artery, you are right. From the axillary artery, you are right. From the vertebral artery, you are right. From the intercostal arteries, you are right. فنحفظها بهالطريقة. يعني ما نريد ندرخها بطريقة تدرخ البرانشات بطريقة it will be forgotten in the future. يعني أريدك تقول إنه من واحد يسألك البريكال بلكسس متغذي بيا شرايين، الشرايين اللي قريبة بهذه المنطقة بالأكزيلا وبالنك وباليم الفقرات ويم بالقسم العلوي من القفص الصدري، هذه من تذكرها كلها تطلع صحيحة. بس طبعا ما نذكر آرتري موجود بعد الشام، شي آرتري بعيد no. فنقول the subclavian, the axillary, the intercostal, cervical, vertebral, all of what you will mention nearby vessels, you are right. Now, I have a close relationship between the axillary artery and the cords of the brachial plexus. In the axilla, one of the major contents present, we mentioned it in the previous lecture, is the axillary artery. During its course, as you see, it is محظونة بالcords مال brachial plexus. It is within it. And as you see, the lateral cord is lateral to the axillary artery, the medial cord is medial to the axillary artery, and the posterior cord in its whole course is posterior to the axillary artery. And accordingly, it is named respectively according to its relation to the axillary artery. طبعا all of this bundle is surrounded by the axillary sheath. Axillary sheath اللي هو continuation of the prevertebral fascia, one of the deep fascia of the neck. من cervico-axillary canal ذكرناها بمحاضرة الأكزيلا. It will cover the axillary artery and the brachial plexus to keep it in its position, supported and fixed and protected from the surroundings. The axillary vein, you will find it always here, medial to the artery, it holds its course, and it's outside the sheath. يكون برا الشيث. At the end, put it all together. The roots, the terminal branches, the minor branches, the regions, the relation to the axillary artery, the bones, put it all together. Ultimately, you will have this beautiful structure of the brachial plexus اللي يعكس حكمة الخالق في خلق الإنسان. And have fun by reading this lecture with good luck. Thank you very much.